Thank you. My name's Ojara Sande. I'm a gynecologist working at St. Mary's Hospital, my lovely hospital for the rest of my life. I came here as a young junior student, and I have the privilege that I've grown here, work here, and I'm now working as a gynecologist. And I invite my friend Robert. You're welcome. Thank you.
Thanks.
Yeah. The St. Mary's Hospital is a wonderful place that I love. It has trained me right as a nursing student, and I've made it through work in ICU where I got my strong motivation to help. And my first thinking, I thought I was going to do emergency medicine. But then I later discovered that the key in the setting was helping the women who comes and they need urgent help, those who are bleeding and those who are having difficult births. And that's why I measure myself to do obstetric and gynecology, contributing to the need for the community. We see a lot of work, and daily we have about 15 to 30 deliveries. And out of that, about 15 normal, and then the other 15 we do cesarean section. And monthly, if we take including our peripheral site, Opit, Pabo, and Amuru, with the referral that come in our setting, we have a total of 500 delivery. And that's accumulating a year close to 10,000 delivery now that we are offering. And they are very challenging cases. Even right now in the theater, one of the women I've been working on, she was actually referred over 150 kilometers from central Uganda, traveling up to northern Uganda here to seek the care that we are having. And this gives us variety of patients that we see. Now, with the coming in of many universities, we welcome our dear friend from Bicocca University, from Milan, that the student, since the induction of the training, we've been having the undergraduates that have been coming to us and observe and learn. And one of these has built us with strong need for desire to expand the knowledge of students and also give capacity for we, the health workers in the hospital, so that we gain the skill and also exchange the global idea in how we can improve maternal care in Africa and also globally through collaborative research work, which will bring an impact in a global context, because the kind of training that we have here is mixed. We have the nursing student, we have the student from the midwifery school, we have the student who attend the theater student, and then we also have the laboratory student. And we have also students from the Gulu University, Mbara University, who come here for the internship. So having the international student joining us in this forum of training, we believe and we think this strong collaboration will improve in our quality of care and also improve the student capacity and skill in their field of learning, and will also give them professional interest in areas of specialization. And above all, working with Bicocca University and Lasho Hospital, we know that we can have strengthening of innovation, strengthening of capacity of the staff, and then also go ahead to have capability of doing interventional research that fight most of our disease burden. And key in our setting here, we have cervical cancer that is affecting many of our gynecological women. We need to find an intervention how to fight the cervical cancer, both as a treatment model and then also as a preventive model in the community. And that should be by training and also education of the young children. And then the other aspect is also identifying high-risk group of women who are in the community, train them, pick them earlier so that we make early referral to the hospital to minimize risk from the community so that we have safe delivery. We have maternity waiting home that we've actually named it to our best loving sister, Dominica team. And this is Mama Team Waiting Home. And this is an excellent home that any woman who is from far away, we admit and keep in the place so that we have safe births for both the mom and for the baby. We also want to think that through this collaboration, as we do community intervention, we pick out certain risks with pediatric cases, including difficult congenital anomalies and also some of the cardiovascular conditions that children should be cared for. And the babies that we deliver, we also want to perfect into our neonatal care, which is already a project ongoing with the hospital and then the University of Bikoka. We want to improve the care of babies who are born prematurely and then also improve the skill of the staff in this performance. So, Dr. Robert, you're most welcome to our setting, and we still believe that we shall have a stronger way to train the student, and I welcome you so much. So you're most welcome to our place.
Thanks.
Yeah, I am Robert Fruscio. I am Associate Professor in Obstetrics and Gynecology at the University of Bikoka. This is my first time here in Lachor, first time in Uganda. And I am here because we have a long-lasting tradition in the global health field that was initiated by the former residency chief, Professor Patrizia Vergani. But then she introduced me to Dominique Corti, and I had the feeling that Lachor would be a really great place for our residents and for our students to learn, and also a really good place to start new projects on, as Dr. Ojara was saying, cervical cancer and many other fields. And I have to say, it was really a pleasure meeting Dr. Ojara, and we talked for 2 days, and we had so many ideas, and this is a confirmation that this probably is the good place for our residents to grow. And I agree that our collaboration could be both in the field of research, both in obstetrics and in gynecology, and in the field of training. So I believe that working together we can really take advantage of each other from the work together. And one example is we were talking about the introduction of the laparoscopic technique and the laparoscopic training for probably not only people here in Lachor, but from
Eastern Central Africa
and East Central Africa. So it's really been a great pleasure to be here in these few days, and I am sure that our collaboration will really give us many, many satisfactions.
When we have students who come for training, students come with new thinking, and then that new thinking add value, and that value bring quality improvement project. And quality improvement project entails to safety of the patient. So one of the thinking about introduction of endoscopic surgery is we want to see our patient have safe operation, spend less time in the hospital, and also reduce hospital cost, because doing open surgery is a technology in the Europe is now celebrated over 100 years, but something in Africa we've not yet seen it, and we think Lachor Hospital is so blessed in a position that we can champion this in East Africa to train the young scholars who are going to come, so that we have improved safe surgery throughout the region. And this can be joined hand with Bikoka University, and then the training of East and Central African College of Obstetrics and Gynecology, which Lachor Hospital is affiliated. I am the program coordinator in the hospital, and we've signed this to have every year 2 fellows who come for the rotation here. So this would be a very excellent performance in contributing to the care of our people. And then also the students who come from Milan will also find an easy training environment, because we would have set simulation lab, would have set our theaters that accommodate their training purpose, so that when they leave Milan, the environment change is not quite different, but they have similar immersion into our setting. And this is our dream for a better place for training, for a better place to offer good care, and for perfect future generation of health workers. We welcome this contribution.
Another example is the work that Sophia will talk about.
Oh, yes.
This was the first retrospective research, but that might reflect on development, prospective development, and probably increase of the quality of care of the maternal well-being.
Exactly. The Sophia project has come from student interaction with quality improvement. And Sophia interest came from how do we improve women who are critically sick? Can we find tools to monitor them? And that's the idea that she came up with. And now we are trying to review our data in the whole. Is our work in line with what the world standard is? And after that, we have many series of projects that Sophia's work can generate. Can we test the existing tool, whether it's applicable in Africa, so that we can implement it? And this is the real idea of having students interacting with our care and posing questions that bring a challenge to how to improve what we do routinely. There are many aspects of the student involvement, including Noem did work on following up women who have come for cervical cancer screening. How easy can they walk and find out that this something is being done? So we think many other form of collaboration can easily come up in this kind of setting.